I'm going over how to prep a patient for surgery. I will begin with the insertion of the IV catheter. Before the IV catheter is inserted, the patient will need to be given a sedative, which will take about 15 minutes to kick in. During this time, you can prepare all the materials you will need for insertion. There are several materials you will need to insert an IV catheter. The first is a clipper with a number 40 blade. Then you will need alcohol and chlorhexidine scrub, some gauze, 3 strips of surgical tape long enough to wrap around the patient's limb 1.5 times, an IV fluid flush or an IV fluid line, LRS or sodium chloride, and a PRN cap. Once the patient has been intubated, tie the tube securely to ensure it won't fall out, and then check for any leaking or blockage of the tube. Once you are done checking, attach your patient to a monitoring device to ensure their safety. This is also the time you want to lubricate their eyes to prevent them from drying out and causing damage. At this point, the patient can be repositioned in a way that allows you to access the surgery site. Now that your patient is in position, take the number 40 clipper blades and trim 10 to 20 centimeters around the incision site. You will need multiple passes with the clipper blade to ensure that there is no fur remaining. The first pass should be with the grain of the fur, and any subsequent passes should be against the grain of the fur to ensure that there is no remaining hair in the area. While trimming, make sure the shaved area is neat and symmetrical. Once the area has been fully shaved and no fur remains, you will take a vacuum and clean up all the hair off of yourself, your patient, and the area around you, making sure there is none left. Once you've ensured there is no more hair in the area, you will begin your first sanitization step, which is called the dirty scrub. The purpose of the dirty scrub is to clear the skin of any dirt and oils. To do this, you take gauze soaked in antibacterial soapy water and scrub the skin thoroughly. Keep doing this until your gauze comes away clean. The second step is the proper sanitization. For this step, you will need 2 clean bowls with at least 3 gauze pads each. The gauze in the first bowl should be soaked in antibacterial soapy water, and the gauze in the second bowl should be soaked with 70% alcohol. Starting with the antibacterial gauze, start at the incision point and work your way in circles around the incision point, never repeating any area you've already wiped. Once you're finished that, the next step is to apply a final sanitizer. This is usually either betadine or a similar solution. Once the final solution has been applied, the incision area is now considered sanitized. If it makes contact with anything unsterile, it must be re-sanitized to ensure the patient's safety. Once the patient has been prepared for surgery, carefully pick them up and move them to the surgery area where they will be placed in the appropriate position.